Hi everyone, my name is Gabriela Miranda. I'm a dentistry student at the Federal University of Pernambuco, and I will present the work entitled Oronasal Fistula after palatoplastia. Palatoplastia is a procedure which aims the anatomical reconstruction between the nasal and oral cavity, muscle reposition, and complete restoration of the structures of the velopharyngeal sphincter in order to provide adequate velopharyngeal closure for speech development. One of its complications is the oronasal fistula that we can see here in these images. This occurs due to excessive trauma to the margins of the flaps during surgery, inadequate dissection of the palatal flap, inadequate attachment of the palatal tissues to the nasal mucosa, infection, flap necrosis, traumas, and hematomas. Oronasal fistula is defined as abnormal communication between the oral and nasal cavity, and there are other causes for this fistula, and there are periodontic diseases, periapical abscess, trauma, neoplasm, congenital malformations, radiation necrosis, polyperformance tooth extractions, and polysurgical stitches are some of the most frequent causes of this fistula. These fistulas lead to functional problems, such as hypernasal speech, nasal emission, and regurgitation of food through the nose. So the treatment is basically surgical, and there are several techniques that have been addressed in the literature. So the objective of this work was to study the surgical techniques for the closure of oronasal fistulas. And for this study, the methodology followed was the PRISMA recommendations. It outlined the guiding questions: which techniques can be used to close the oronasal fistulas? A research was carried out in the Cielo and PubMed databases using the descriptors oronasal fistula, surgery oral, and palatoplastia. And more studies were excluded, and the research has found the following results. There are several techniques for repair of oronasal fistulas, such as mucoperiosteal flap, temporal parietal flap, palatal flap, pharyngeal flap, and tongue flaps. I will describe some of these techniques that were described by the authors in the research. The first one is the mucous flap, was described by Filho to close a large oronasal fistula. In this technique, we have here the oronasal fistula in the first image, and in the second, we can see the incision that is made in the mucosa and in the muscle, and then the detachment. The flap is taken to the fistula region and is sutured. So the patient has involved with healing. Another technique is the palatal flap that we have here. The palatal flap is another alternative, which consists of performing two converging incisions of the palates, detach the flap, and positioning over the fistula. So the flap is fixed with sutures, and the palate is healed by second intention. The graft has a good vascularization, which provides a good postoperative result. In these studies, they are also described an adjunctive therapy to improve the surgical outcome in oronasal fistula. And they are antibiotic therapy to control the infection. Also, they can use resorbable collagen membrane, which the objective is improve the stability of the soft tissue and decrease the incidence of the new disease. And also they can use plasma-rich growth factor that is obtained by centrifuging the patient's blood. And it is the third layer obtained, and this third layer can be mixed with autologous bone grafts. So with this work, we can conclude that there are several presentations of palatal fistulas and a variety of techniques for their correction. Therefore, it is important to know them in order to use the most suitable for each case. So these are my references and also my contacts. Feel free to contact me, and thank you so much for the opportunity, and good afternoon.